Welcome to the deep dive. We've got some listener research to unpack today, and it's all about endolymphatic eye drops.
Yeah, it's a pretty complex topic.
It is, but luckily the source our listener sent is amazing, a downloadable guide from an Italian ENT doctor.
Oh, yeah, Dr. Andrea Latorre.
Yeah, and he really breaks it down so anyone can understand it, which is great because, like I said, it's complicated.
It is.
So maybe we should start with, the basics. What is endolymphatic eye drops?
Okay, so basically, think of your inner ear like a deli-shit seashell, right?
Okay.
And it's filled with fluid. And when there's a buildup of that fluid, that's endolymphatic eye drops.
So it's like a pressure issue.
Exactly, a pressure imbalance.
I see.
And, a lot of people associate it with Meniere's disease, but
Right.
it can actually cause a whole bunch of different symptoms on its own.
Yeah, so obviously the big ones, tinnitus, hearing loss, vertigo.
Right.
But the guide also mentions a feeling of fullness in your ear, sensitivity to noise, even motion sickness.
Yeah, it's pretty wide range.
It is. That's a lot.
And one thing that Dr. Latorre really emphasizes is that it's reversible and treatable.
Oh, okay, so that's good news.
It is. It's just a matter of figuring out what's going on and finding the right approach for you.
So how does all this fluid buildup even happen?
So to understand that, we kind of have to get into how the ear works.
Okay, let's do it.
So you've got the outer ear, middle ear, and the inner ear, right?
Mhm.
The inner ear is where all the magic happens.
Okay.
And there are these two key fluids in there, endolymph and perilymph.
Ooh, fancy names.
They're essential for hearing imbalance,
Right.
And when the volume of these fluids gets out of whack, that's when you start experiencing those symptoms.
Okay, so that's the connection.
Exactly.
But what's causing this imbalance in the first place?
Well, that's where things get really interesting.
I'm intrigued. Tell me more.
So Dr. Latorre points to this hormone, ADH. Yeah, antidiuretic hormone. It regulates fluids in the body.
Right.
But he cites a bunch of studies that show it also plays a role in regulating fluid levels in the inner ear.
Interesting. So it's like a double duty hormone.
It is. And here's where it gets even more interesting.
Okay, lay it on me.
Stress, any kind of stress, can trigger the release of ADH.
So all that pressure in my ears after a crazy day?
It could be more than just tension, yeah.
So it's actually messing with the fluid in my ear.
Potentially, yeah. It could be contributing to that buildup we talked about.
Wow, that's wild. But okay, if this is all happening inside the ear, how do doctors even figure out if that's what's going on?
That's a great question. And Dr. Latorre actually prefers to rely more on good clinical reasoning.
Oh, interesting.
And really listening to your symptoms.
So less about the tests and more about what the patient's actually experiencing.
Yeah, he's not a huge fan of just throwing a bunch of tests at the problem.
Right.
He says a lot of the tests for inner ear problems can be unreliable or misinterpreted.
That makes sense. So he's really focusing on the individual?
Exactly. He pays close attention to the characteristics of your symptoms,
Okay.
So, if your symptoms are fluctuating, coming and going, changing in intensity, that usually points to something reversible, like endolymphatic eye drops.
Oh, so that's a good sign in a way.
It can be, yeah.
Okay, so that's fluctuating symptoms.
But then there are, fixed symptoms, the ones that are constant and don't change.
Right.
And those might indicate permanent damage.
Okay, so that's a key difference.
It is. He gives this example of, inconsistent test results.
Okay.
So say you have a test and it shows something weird one day, but then it's normal the next. That's a big red flag for fluid fluctuations, which are a hallmark of endolymphatic eye drops.
So it's like he's looking for those inconsistencies.
He's putting the pieces together.
Interesting. So the tests aren't useless.
No, not at all.
But they're not the whole story either.
Right. It's more like using them in conjunction with your symptoms and the doctor's judgment.
It's a more holistic view.
Exactly. It's about seeing the bigger picture.
And speaking of the bigger picture, I think we need to talk more about this whole stress and ADH connection. We got to go deeper on that.
Yeah, absolutely. There's a lot to unpack there.
Okay, so stay tuned because we'll be right back after a quick break.
We'll be diving into that and more in part 2.
You won't want to miss it. Okay, so we're back and ready to dive deeper into this whole stress and ADH connection.
Yeah, it's one thing to understand the science behind it, but it's another thing entirely to actually live with these symptoms, the emotional impact and all that.
Totally. And I like how Dr. Latorre addresses that in his guide.
Yeah, he really doesn't shy away from it.
No, not at all. He actually dedicates a big chunk of it to talking about the role of anxiety and fear.
Especially with vertigo, right?
Exactly. He even goes so far as to say that the psychological reaction can be more debilitating than the actual physical sensation of vertigo.
That's so interesting, right? Like, the fear of the spin is almost worse than the spin itself.
Yeah, exactly. And remember that analogy you uses, the vertigo funnel?
Oh, yeah, that's a good one.
Can you explain that again? I think it's so helpful for understanding this whole anxiety piece.
Sure. So picture a funnel, right?
Okay.
The top of the funnel, the wide part, that's like all of the potential triggers for vertigo.
Okay, so like what kinds of things?
Fluid imbalance in the inner ear, stress, even changes in like barometric pressure, stuff like that.
Okay, I see.
So all these things can kind of kick things off.
Right.
But then as you go down the funnel, it gets narrower and narrower.
Okay.
And Dr. Rattori's point is that all recurring vertigo ultimately comes from like a problem in the inner ear.
Okay.
But our anxiety about it, the fear of the vertigo, that actually makes the funnel even narrower.
Oh, so it's like amplifying the problem.
Exactly. It makes even small disturbances feel like this huge, overwhelming spin.
Like the fear is feeding the vertigo.
Yeah, kind of. And that's where, his whole treatment approach comes in.
Right, because if anxiety is making things worse, we need a way to break out of that cycle.
Exactly. And he believes in addressing both the physical and the psychological.
So it's a two-pronged approach.
It is, yeah.
Treat the inner ear and manage the mental and emotional impact.
And I think knowledge is such a big part of that,
Right, like the more you understand what's happening in your body,
exactly,
the less scary it becomes.
Dr. Latore is a big advocate for patient education.
So true. Okay, but what about those times when, like, even though you understand what's going on, the anxiety is still just, like, overwhelming?
Right. Well, he's a big believer in seeking professional help when you need it. Like, don't just try to touch it out.
It's okay to reach out for support.
Yeah, there's no shame in that at all.
I think that's so important, especially with a condition like this.
He also really emphasizes, like, having a good support network.
Oh, yeah. Friends, family,
exactly.
People who get it.
And he even mentions, like, online support groups.
Right. Those could be so helpful.
Yeah, just knowing you're not alone.
Totally. Okay, so now I want to shift gears a bit and talk about like the actual nuts and bolts of his treatment plan.
Okay, yeah.
So, one thing that kind of surprised me is that he's not a fan of the low-salt diet.
Oh, yeah, that's a big one.
Yeah, like that's pretty much standard advice for Meniere's.
It is.
So why does he break from that?
Well, he basically thinks it's ineffective. He believes it's not just about cutting out salt, but understanding how different foods and substances impact like fluid regulation in the body.
It's more nuanced than just salt.
Right. It's more about the bigger picture.
Okay, makes sense.
And a big part of his approach is actually increasing water intake.
So not less fluid, but more...
It's not just about drinking more water casually, though.
Okay.
He has like a very specific method for how to do it throughout the day.
It's like strategic hydration.
It is, yeah.
So that's the base of his treatment pyramid, right?
Exactly, the foundation.
Water and managing stress. And then as you move up the pyramid, there's neuropharmaceuticals.
Yeah, to address the stress.
Right, because we know stress triggers that ADH release.
Exactly, so these meds can help interrupt that cycle.
It's not about masking the problem long term, right?
Right.
It's more like giving your body a break to reset.
A strategic intervention.
Okay, so what else is in this period? What comes after the neuropharmaceuticals?
Well, corticosteroids are another big one.
Okay, those are powerful anti-inflammatories.
They are, yeah, and they can help reduce the effects of ADH on the inner ear.
So he uses those too, but I'm guessing not in the typical low-dose, long-term way.
You're right. He prefers a more targeted approach.
Okay.
So like a single high-dose injection of a long-acting corticosteroid or IV infusions in some cases.
Again, maximize impact, minimize long-term exposure.
Exactly.
And what about those IV infusions with diuretics?
He's a big fan of those too, yeah.
Okay, those help the body get rid of excess fluid, right? But I bet he has a specific way of doing them.
Oh, absolutely. He's all about the details.
So what's his protocol for the IVs?
Rapid infusion.
Okay.
And making sure the patient's well hydrated before and during.
So it's not just like hook him up and let it drip.
No, it's much more precise than that.
Okay, so we've covered the foundation of the pyramid, the water and stress management.
Right.
And then these more targeted interventions, the meds and IVs. But we know he also likes those less invasive options whenever possible.
Oh, yeah, like the Otavent balloon.
Oh, yeah. What is that again? I'm not familiar with that one.
It's like this little balloon you inflate with your nose.
Okay.
And it helps create counter pressure in the ear.
I see.
Which can promote fluid drainage.
It's like giving your inner ear a workout.
It kind of is, yeah.
What about tinnitus? Anything specific for that?
He likes masking techniques.
Oh, right. Using external sounds to drown out the tinnitus?
Exactly. And there are tons of apps for that now.
Really? Oh, that's cool.
Yeah, you don't need any fancy equipment.
That's good to know. And he mentions hyperbaric therapy too, right?
He does, yeah, but not as often.
That's the one where you breathe pure oxygen in a pressurized chamber, right?
That's the one.
Okay, so he's open to lots of different options?
He is. It really depends on the person.
It's not like a cookie-cutter approach.
No, not at all.
It's very personalized, which I really appreciate.
And he actually mentioned in this medication, tolvaptan. That seems really promising.
Oh, tolvaptan, what's that?
It's a drug that specifically blocks the action of ADH.
Whoa, so it goes right to the source.
It does, yeah, but unfortunately it's not widely available for this use yet.
Oh, Willie.
Yeah, he even tried to, advocate for it, reached out to pharma companies and research centers.
But he hit a wall.
He did, yeah, which is frustrating because it could be a game changer for some people.
Ugh, that's tough, but at least he's trying,
He is. It shows how dedicated he is to finding solutions.
Yeah, for sure. Okay, so we've talked a lot about his approach to treatment, but I'm curious, what's it actually like to be his patient? How does this individualized approach play out in the doctor-patient relationship?
Well, he really emphasizes collaboration. He wants patients to be actively involved. He wants them to educate themselves, ask questions, be a part of the decision-making process.
So it's a true partnership.
It is, yeah.
I like that.
And he talks about, the importance of finding a doctor you trust.
Right, someone who listens.
Exactly, who respects your concerns.
It shouldn't feel like you're just following orders.
No, it should be a conversation.
A two-way street.
Exactly.
That's awesome. Okay, well, this has been super informative.
I know, right? It's fascinating stuff.
And in part 3, we're going to dive into some of his more specific diagnostic insights.
Oh, yeah. That's where it gets really interesting.
Yeah, so stay tuned. We'll be right back after the break. And we're back for the final part of our deep dive into endolymphatic eye drops.
Yeah, we've learned so much from Dr. Latour's guide.
We have, but there's still more to uncover.
Definitely.
In this last part, I want to focus on his diagnostic process because he really seems to rely on, clinical reasoning.
Yeah, more than just relying on a bunch of tests.
Exactly. He trusts his expertise and his observations, which, kind of goes against the grain a bit these days.
It does, in a way.
Everything's so high-tech in medicine now.
It is.
But he actually says in the guide that...
oh, yeah, I remember this part.
The diagnosis for tinnitus, vertigo, and other inner ear issues is based on reasoning.
Yeah.
Based on knowledge of human anatomy and physiology.
And evaluating symptoms.
Right. So basically he's like, I trust my gut. I trust my experience.
Yeah. He's seen so many patients over the years. He's like, I know what I'm looking for.
But isn't that kind of risky? I mean, what about all the fancy tests?
Well, he's not saying tests are useless. He just points out that the inner ear is hard to examine directly.
Okay.
And a lot of the tests out there can be unreliable or they're easily misinterpreted.
Right. So it's not black and white.
No, it's more nuanced than that.
So he's urging caution with the tests.
Yeah. Interpret the results carefully.
And pay attention to the whole picture.
Exactly.
And that's where his observation skills come in.
Oh, yeah. He's big on that.
He really focuses on those symptom characteristics, are the symptoms fluctuating, coming and going?
Right, or are they fixed, staying the same all the time?
That seems like a key difference.
It is, for sure.
Because fluctuating symptoms often point to something reversible.
Like endolymphatic eye drops.
Exactly, but fixed symptoms might mean there's permanent damage.
So that helps guide the treatment plan.
It does. And does he give any examples of how he uses this in practice?
Yeah, he talks about a patient who might have a test that shows a problem one day, but then the next day, the test is normal.
Okay, so inconsistent results.
Exactly, and that's a sign that fluid levels are changing.
Which is a hallmark of endolymphatic hydrox.
Bingo.
So he's like a detective, right?
He is, yeah.
Looking for clues.
Connecting the dots.
And that reminds me of how he feels about, searching for a single cause for the symptoms.
Oh, yeah, he's not a fan of that.
He doesn't like that blame game.
No, because so often people are like, oh, it must have been that loud concert.
Or I bumped my head a while back, that must be it.
Right, but he cautions against that kind of thinking.
Correlation doesn't equal causation.
Exactly.
So just because something happened before your symptoms started doesn't mean it's the cause.
It might be a factor, but it's probably not the whole story.
Right, so what is the story then?
Well, that's where stress comes back into play.
Of course.
Remember, stress does all sorts of things to our bodies.
Clenched jaw, tense muscles.
And it triggers that ADH release.
Which can lead to endolymphatic hydrops.
It's like a chain reaction.
So the stress sets it all off.
Potentially, yeah.
And I think this highlights a really important point from Dr. Latour.
What's that?
It's not about obsessing over finding that one single cause. It's about understanding the bigger picture.
How everything's connected.
Exactly, the complex interplay of factors.
And that brings us back to his concept of sufficient benefit.
Oh yeah, that's a good one.
It's not about chasing a cure.
Right.
It's about finding relief, enough relief to live your life.
To function, to be happy.
Exactly. Exactly.
So setting realistic expectations.
And working with your doctor to find the best path forward.
And it all comes back to patient empowerment, doesn't it?
It does, yeah.
Dr. Latore wants patients to be informed, to ask questions, to advocate for themselves.
To be active participants in their care.
I love that. It's such a powerful message.
It is.
You are your own best advocate.
At the end of the day, it's your body, your health.
You have the power to make choices that support your well-being.
And even though endolymphatic high drops can be tough to deal with,
yeah, it can be really challenging.
Dr. Latore's guide gives us hope.
It does. It shows us that there are things we can do.
There are ways to find relief.
To manage the condition.
To live a full life.
That's a great takeaway, I think.
I agree.
This has been such a fascinating deep dive.
It really has.
We've learned so much from Dr. Latore.
He's given us a lot to think about.
He's challenged us to think differently about endolymphatic high drops.
To consider the role of stress.
To embrace a personalized approach to treatment.
And to become active participants in our own health journey.
Couldn't have said it better myself. Well, that's it for this deep dive.
It's been a pleasure exploring all this with you and our listeners.
Thanks for joining us. We'll see you next time for another deep dive into the world of health and wellness.